Hello viewers, this is your host, the Trial Buddy. Welcome to the part 2 of the video. Well, in the previous part, we came to know how Dr. James Lind started the clinical trials and when do we celebrate International Clinical Trial Day. If you have not seen the part 1 History of Clinical Trial, I have given the link in the description. You can watch it from there. Today I will take you through the clinical trial we perform nowadays, how these clinical trials get evolved time to time. So without doing any further delay, let's just jump straight into the topic. At first, I will talk about placebo. So what is placebo? Well, placebo is a pill-shaped material which is prescribed to the subject for psychological benefit rather than any physiological effect. When people take placebo and get cured, the effect produced by this is known as placebo effect. This effect came into existence for the first time in 1799 by a British physician named John Haygarth. He took 5 people and let them sit on a stool and rotated some stick around them and pretended that he is taking the pain out of the body through the sticks. And this is how he showed people that they can be cured psychologically because out of 5 people, 4 of them get cured from their condition. Now let us talk about the very first controlled clinical trial. The very first controlled clinical trial was performed by United States physician Dr. Austin Flint in 1863. Now the question comes, what is controlled clinical trial? To answer the question, I would simply say take some patients and divide them into 2 groups. Give one group placebo, other group the trial medication, and in the end, comparing both the groups' physiological changes. The resulting experiment will be called controlled clinical trial. This was an example to tell what controlled clinical trial is, as these comparisons could take place between placebo and already present medication for a specific condition. Dr. Austin Flint conducted the first experiment on comparing a dummy remedy with an already existing remedy. He took 13 patients suffering from rheumatism. His remedy was herbal extract of highly diluted tincture of cassia. He concluded that there were no significant difference in the result when he compared the placebo with the active treatment. Treatise on the Principles and Practice of Medicine, published in 1886. There are some other clinical trials also, which are called double-blinded clinical trial, randomized clinical trial. Well, I will be explaining about each trial in a separate video for each. With this, I come to the end of today's video. In the next video, I will explain about the 2 big tragedies due to which today's modern clinical trial got this shape and guidelines came into existence. If you like the video and like the information, stay tuned with us for the next video. Thanks for watching.